apnea is one of the most common sleep disorders, but it can be treated. And joining us now is Dr. Karen Wuertz from Craniofacial Transformations to tell us more about sleep apnea and related sleep disorders and how to treat them. So let's just start from the beginning. What exactly is obstructive sleep apnea?
Well, first thing I want to tell you, we have about 42 million adults in America who have a sleep disorder. Sleep disordered breathing. So sleep apnea is just one of those disorders. And what it is where when we sleep, the muscles of the back of our throat relax and intermittently kind of close off our airways. So it's very serious.
Oh my, yeah. And I would imagine it's very difficult for somebody to sleep, 8 hours.
Oh, absolutely. What happens is the airway narrows while we sleep, and so you don't get enough oxygen in. And so what happens is people will wake up intermittently throughout the night. Sometimes they're not even aware that they're waking up. And so they'll actually kind of sleep through it, wake up and down. And so it's usually a bed partner that notices it.
Snoring?
Snoring, oh yeah, very loud snoring like a lumberjack.
Yes.
Yeah.
Now, you mentioned those are, I guess, some nighttime symptoms. Are there additional ones? And what about daytime symptoms?
Some of the most common daytime symptoms are what we call excessive daytime sleepiness. You wake up in the morning and you're very tired. You feel like you haven't even feel like you run a marathon. You can have also lack of focus, lack of concentration during the day. You may be irritable. You may have suffer from depression.
Just overall tired.
Overall
it sounds like
tiredness.
The symptoms of being exhausted.
Absolutely.
What can we do about it?
Well, there are various treatments. First thing, you have to get a diagnosis. There are a couple ways to do it. I recommend that you see your primary health care provider. We need to have a proper diagnosis. You can have mild obstructive sleep apnea, moderate, and severe. And so depending on the severity of it, we have different treatment options.
I gotcha. So give me an example of a mild treatment option versus one that's a little more severe. What would you do?
Well, for mild sleep apnea, you may want to looking at what caused it in the first place. Sometimes it can be hereditary. Sometimes you need to just wear an appliance at night. Sometimes you need to use a CPAP machine for continuous positive airway pressure to open up the airway. But for people with mild sleep apnea, if they're overweight, fat deposits also in the upper airway. So losing weight. You want to make sure you maintain a healthy diet. You want to make sure that you go to sleep at the same time and wake up. Have a very nice pattern of sleep that you can follow every night. Avoid alcohol. Anything that's sedative, sleep aids, even Benadryl at night can also relax you enough that you might have problems breathing.
So avoid those.
Avoid those. Caffeine 2 hours before bed. Don't eat a heavy meal. Some people have obstructive sleep apnea when they're sleeping on their back. So maybe sleeping on your side, maybe propping up your bed at night. So that's for mild treatment.
And what if it's severe?
If it's severe, you need to have an in-lab study done with your physician. Only a board-certified sleep physician could make the diagnosis. In that case, they may start with a CPAP machine because patients who have it very severe, we need to get them breathing properly at night because it can have very big implications to your health long term.
I would imagine so. With that much sleep, can cause havoc on your life. Thank you for being here today.
Oh, thank you so much.
So many people deal with this. It's nice to get this information. We appreciate it. Craniofacial Transformations. They're in Chesapeake as well as in North Carolina, and their website is craniofacialtransformations.com. To call them, 252-335-4341.